Hello everyone, welcome to Yashoda Hospitals online segment, the Health Talk session. Today's topic is valvular heart disease. Do post your queries on our comment section and we'll get them answered shortly. I'm Dr. Lakshmi and today we have with us Dr. Rajasekhar, Senior Consultant Cardiologist from Yashoda Hospitals, Secunderabad. Welcome, sir. So to begin with, how common are the valvular heart disease in our country, and in the recent trends, how has it been going?
Valvular heart disease is fairly common in our clinical practice. If you look at the profile of valvular heart disease, a couple of decades ago, predominant cause of valvular heart disease was rheumatic heart disease, where a childhood rheumatic fever leads to scarring of the heart valves, especially the mitral and the aortic valves, and with advancing age, the patients present to us with problems with those valves. But by and large, now with an active rheumatic heart disease prophylaxis program, we see a declining trend or declining incidence of rheumatic heart disease, and we are seeing more cases of degenerative valvular heart disease. Basically, degenerative valvular heart disease is a manifestation of degeneration or aging process that occurs in the heart valves, the mitral valve as well as the aortic valve. And this with the increasing longevity and increasing health standards, as people are living longer, you see more incidence of degenerative valvular heart disease. More often, the degenerative process affects the aortic valve. It's called degenerative aortic valve stenosis, and it is usually seen in the elderly. In a small subset of people, this is congenital. It is present from birth. Normally, the aortic valve is tricuspid. It has got 3 leaflets, but in some people, by birth, it is either bicuspid or monocuspid. So these valves are prone for more wear and tear with age, and therefore they present with valvular heart disease affecting the aortic valve. That is called bicuspid aortic valve disease. That is a small subset of our patients, but predominantly when we speak of valve disease in the adults, it is largely degenerative valve disease.
So, sir, what is the common age group that they would be presenting with the valve disease?
When we speak of degenerative aortic valve disease, typically this presents after the 5th decade, usually in the 6th, 7th decade, and sometimes in the 8th decade. So usually most of these patients who have degenerative aortic valve disease are in their 70s or 80s. The younger ones usually have a congenital aortic valve disease or a rheumatic valve disease, but the older patients usually have a degenerative heart disease.
Do post your queries on the topic heart and valvular disease and we'll get them answered shortly. So taking few questions from a social media network, we've got Mr. Rajesh asking us from Hyderabad. What are the problems that can cause valvular heart disease?
Already spoken about the potential causes of valve disease. It can be rheumatic valve disease, congenital valve disease, or it could be degenerative valve disease. So what do the patients with valve disease present to us? What are the symptoms that they have when they come to us? I think that's what you're trying to understand. People with valve disease usually come to us complaining of either breathing difficulty on exertion, it's called exertional breathlessness, or they can come to us with chest pain, or with rapid heart palpitations, or they can come with episodes of giddiness or blackout, which we call syncope. And these are the different symptoms with which a patient with valve disease can come to us. And once the patient comes to us with any of these symptoms, we investigate the patient for valve disease. One is we start by doing a physical examination. In a physical examination, we often detect the signs of valve disease by the presence of a sound called a heart murmur. There's a rumbling sound inside the heart when we auscultate with a stethoscope that we call a murmur. So the presence of a heart murmur usually indicates the presence of a valvular heart disease. And once we detect a murmur in a patient, we subject the patient to further investigations in the form of an echocardiogram and an electrocardiogram. There are two types of problems that can occur with problems with valve disease. It could be either the inability for the valve to open completely, or it could be an inability for the valve to close completely. In the previous instance, that when the valve is unable to open properly, there is obstruction to blood flow across the valve. That is called valve stenosis. And if the valve is opening well but it's not able to close properly, there is leakage of blood across the valve. That is called valve regurgitation. In many situations, there is a combination of both valve stenosis and valve regurgitation.
So, sir, someone diagnosed with valvular heart disease, what are the symptoms that would suggest that the disease is getting worse?
Yeah, most of the time when somebody comes to us early in the stage of a valve disease, we manage to treat them with medications. Medications will be able to control their symptoms to a significant extent. But a point will come in the progression of the disease when the disease has become very severe and medications are no longer sufficient to treat the disease. The signs to watch out for in an individual who suffers from valve disease is worsening breathlessness, worsening chest pain, and inability to carry out his normal activities of daily living, which he was able to do earlier. So, if any change in the clinical functional status, we call it a functional status of the individual, that is, the individual is not able to carry out his normal activities of daily living, which he was a few days back or a few weeks back was able to carry out without much difficulty. So when there is a worsening clinical condition or functional capacity of the individual, that is the time when the individual should seek a medical review to reassess his heart condition and decide if something more than medicines is required.
Do post your queries on the topic valvular heart disease and we'll get them answered shortly. So moving to the next question, we've got Mr. Karthik asking us from Nizamabad. He wants to know what is the treatment for severe heart valvular disease.
Yeah, when the valve disease progresses to a stage where the patient is severely symptomatic and is unable to carry out his or her normal activities of daily living without any symptoms, and that is the time when we make an assessment and decide if the patient requires something more than medicines. So unfortunately, in the natural progression of most patients of valve disease, this stage will come one day or the other. And when this happens, the only definitive treatment for these individuals is to replace the diseased valve. That is called a valve replacement surgery. In the case of the aortic valve, that is the main valve that connects the heart to the aorta. It is called aortic valve replacement. Conventionally, this aortic valve replacement is done by means of an open heart surgery.